Okay, so welcome everyone. Thank you all so much for being here today. This is part of the Metro Council Mental Health KC Presents webinar series. I'm so glad that you are here. Just a little bit about Metro Council so that everybody kind of knows a little bit of who we are. So Metro Council actually stands for the Metropolitan Council of Behavioral Health Centers. We represent the public mental health system. So all the community mental health centers in the Kansas City Metro. We're so glad that you're here. We are a collaborative membership and serving all the community mental health centers that represent the greater Kansas City metropolitan area. And we provide support and education and information and resources to the public. So we're so glad all of you are here today. And I'm so excited because with me is Shawn Moore. And Shawn today is going to be talking about supporting caregivers on the home front. So Shawn, thank you so much for being here, and I'm going to let you kind of take it away from here.
Okay, well, thank you for having me. Anytime I get a chance to talk about veterans and their family members and how best to support those family members who are taking care of our wounded and ill veterans at home, I'm right on it. So I am super excited that everyone took the time to take that time out of their busy schedule and come and listen how our community can best support these caregivers and family members. So I am going to share my screen and we will get started. And you'll have time to ask questions afterwards. We'll get this going here. I push the, oops, that's not the right button. Just a minute. There we go. Okay. So today I'm going to be talking about the Campaign for Inclusive Care, and you'll see on this screen, just you can see the screen, correct?
Yes.
Okay, good deal. We're going to talk about the Campaign for Inclusive Care, and it is empowering, engaging family caregivers as partners in care. This originated, as you can see, as a joint initiative of the Veterans Affairs and the Elizabeth Dole Foundation, and I am an alum of the Elizabeth Dole Foundation. I was their caregiver fellow in 2017 for Missouri. And then in 2017, I also founded Caregivers on the Home Front, which is based here in Kansas City as a means of supporting those family caregivers of veterans in all things mental health. So this is it's very personal to me because I also care for a veteran who is my husband. And we oftentimes kind of miss the mark on looking past the client in front of us and making sure their family, as much as we can include them in the care, are included in the care. So this Campaign for Inclusive Care is a joint initiative of, like I said, the VA and the Elizabeth Dole Foundation to integrate family caregivers into their veterans' healthcare teams from day one of the care journey. And the key goal of this campaign is to shift the culture. So not only in the VA, but in our communities. You all have probably heard that the VA can't do it all. There's many veterans that don't even get plugged into the VA. So that leaves it up to us as community providers to make sure we're filling in the gaps. So we want to make sure that we are inclusive of family caregivers so that veteran health outcomes are improved, the caregiver experience is better, and clinicians and staff are more supported and happier in their important work. So when I say caregivers here, a lot of times we think of professional caregivers. And today we're talking about caregivers as those family caregivers. So by incorporating inclusive care through this campaign, really the VA stepped out as a leader among healthcare systems worldwide in creating this model, but what is going to move the needle is making sure that our community providers are on board as well. So we're going to cover a lot of information to better educate you on this inclusive care and this system-wide approach to integrate caregivers into their veterans care team. So today we're going to spend our time together covering and answering the following questions. What is inclusive care? Why is it necessary? How do you practice it? How and what can I do to join the effort? And what resources are available to help? So I'm going to, there's a short video that talks about, basically all of us have heard this in our mental health education practices, how, on an airplane, we put our own oxygen mask on first, and that's what this this short video is talking about, but I am going to skip it and move on. So basically, it talks about having missed opportunities in clinical settings by not creating that system and practice of more inclusive care teams that equally encompass our wounded veterans, their caregivers, as well as the providers. And what I always tell people is that caregivers can be a huge asset to the doctors and other care providers such as yourself, but only if they're in the room or a part of the conversation when the care plans are drawn up. So we're going to look at this model in a little bit more depth. So in designing any innovation, whether a product or service, or in this case, the campaign for inclusive care, it is very important to define the problem and understand exactly what is occurring. And that is what we did in these 3 phases, starting with the first phase that you can see on this slide. In understanding the challenges and opportunities, the campaign's quality improvement team, which is based out of Duke University and the University of Texas Health System in San Antonio, they conducted a robust literature review of inclusive care concepts, as well as caregiver clinician interaction practices. They also interviewed and surveyed clinicians from some of the pilot VAs that started launching this, and they also surveyed veteran caregivers themselves. I happen to be one of those. So we're going to break down each of these 3 components over the next several slides to further show the process that led to organizing the response and establishing and launching this Academy for Inclusive Care. So during the campaign's literature review process, 3 landmark reports within the past several years helped to identify caregiver experiences and needs. So 56% of the time for the ideas about managing their veterans' health. Sorry about that. So on these, they came up with the fact that 72% needed help at home in managing their veterans' health conditions, 69% of the time, whether they have the skills or training needed to do the tasks expected of them. So additionally, caregivers rated that the top barriers to inclusive care hold on just 1 minute. I think that I am skipping a slide here because it wasn't making sense to me, and I'm sure it wasn't making sense to any of you. So in 2014, the RAND Corporation report, Hidden Heroes, America's Military Caregivers, stated that healthcare environments catering to military and veteran recipients should make efforts to acknowledge caregivers as part of their healthcare team. So many military caregivers essentially perform healthcare tasks, and so they need to interact with healthcare providers. And when I say healthcare providers, I'm talking about physicians, mental health providers, psychiatrists, psychologists, social workers, counselors. All of that encompasses this inclusive care campaign. So, however, some caregivers have reported that some environments are not as understanding or accommodating of their engagement and involvement in the care of their loved ones. Some potential solutions include specific documentation to allow the caregiver to participate in healthcare visits, policies to raise provider awareness of caregivers' roles, and training and education of healthcare teams, for example, in how to assess whether patients have a caregiver and how to communicate with them. So for those of us that don't work in the VA healthcare system, the VA has a program for veteran caregivers. So if a veteran comes into your care and says, hang on a minute, I have a caregiver, if you don't know about the VA caregiver program, you're not going to have any idea what in the world they're talking about. And that caregiver program allows them to select and identify a caregiver that then in turn can call, be there in their appointments, and be a part of that care team. But with that being said, even providers in the VA don't know about the caregiver program. So that is why I'm very excited that you all are here today to get some of this education. So a 2016 National Academy of Sciences report, Families Caring for an Aging America, also asserted that practical approaches for inclusion and engagement of family caregivers remain poorly defined. The report committee said that there is a need for change at structural level to integrate caregivers into the healthcare systems. So in part, evidenced by a national survey by the National Alliance for Caregiving and the AARP Public Policy Institute, which found that only 1 in 3 family caregivers, 32%, reported that a doctor, nurse, or social worker had ever asked them about what was needed to care for their relative. Only half as many, 16%, said a health provider asked them what they needed to care for themselves. So lastly, a 2017 RAND blueprint improving support for America's hidden heroes, those hidden heroes are family caregivers taking care of our veterans, underscored these recommendations based on a systemic canvas of the research landscape, specifically highlighting a need for more research on strategies to identify effective programs and policies supporting caregivers' ability even to provide care. Remember, family caregivers don't have the knowledge that you do. Identifying effective programs and policies supporting caregivers' ability to provide care was rated highly important, as caregivers are often thrown into complex situations with little knowledge of where to turn for guidance. Additionally, these landmark reports helped us to identify that there are more than 5.5 million military and veteran caregivers serving across our nation. And these are spouses, parents, family members, and friends of service members and veterans. They assist with a wide range of ADLs and IADLs for wounded, ill, and injured service members and veterans. Apart from having expertise about the patient, accompanying caregivers can also provide critical information to providers about their own capacity and limitations in providing care safely in the home. So this presentation isn't only about how you can better provide care to the veteran, but also the caregivers that are working so diligently behind the scenes at home. However, through interviews and the surveying of these identified caregivers, inclusion had not been the norm. As you can see on slide 7, over a 6-month period, a patient's healthcare team never asked caregivers, for their ideas about managing their veterans' health. 69% of the time, whether they even had the skills or training needed to do the tasks expected of them. And 72% of the time, if they needed help at home in managing their veterans' health conditions. We don't know what we don't know. Additionally, caregivers rated that the top barriers to inclusion they faced from clinicians on the care team were a lack of time by staff to deal with the caregivers. Because I'm not a provider, they don't think I need to know any of the detail. Legal or privacy concerns, healthcare team changes, they change frequently, and a healthcare team that may not know that they are even a caregiver. So we learned through this first phase of the campaign that caregivers experience more health problems face greater strains in family relationships, and have more workplace issues than non-caregivers. Thus, system-wide changes are needed to both provide assistance to caregivers and to help them make plans for family and the future. And I want to pause here and tell you that a recent research article on caregiver distress in military and veteran caregivers and their suicidal ideation associations found that out of 458 military caregivers, 39% of them experienced interruptions in their education, and 23.6% reported suicidal ideation since becoming a caregiver. So we hear about veteran suicide a lot. We don't hear about that staggering number. So informed research and caregiver experience validate missed opportunities in clinical settings if there is not a common system and practice of inclusive care. When the caregiver is integrated into the care team and medical treatment decisions, providers and allied health professionals receive a more complete picture on the health status of the veteran. Without including the knowledge of caregivers who are providing care at home, caregivers' social and emotional needs may not be recognized. Their support for their veteran may not seem to be appreciated, and a lack of caregiver insights on the health of their veteran may result in poor health outcomes. Additionally, reviewing the caregiver journey became critical to this effort. The caregiver journey represents an ever-changing, dynamic human experience. This map was created to outline the journey of a typical veteran caregiver as they adapt to new challenges, emotions, and priorities. So grounded by the RAND Corporation's Hidden Heroes, America's Military Caregivers Study, and support by input from over 500 military and veteran caregivers, researchers, and members of the Veteran Caregiver Support community, this map provides an overview of common moments that most, if not all, caregivers experience. So this is really important. This map is interactive, and you can go online and see all about what these caregivers of veterans go through and what they're experiencing. The stages of the journey provide a framework for common emotions caregivers experience as they adapt to the challenges and changes of caring for a loved one. In stage 1, becoming aware, the caregiver notices changes in the veteran or service member's behavior, and these changes may affect the dynamic of their relationship. Oftentimes, they affect the dynamic of the relationship. In stage 2, shifting priorities and seeking help, the caregiver accepts an increased level of responsibility for their loved one's care and reaches out for external assistance. And then in the next stage, stage 3, finding a rhythm, the caregiver starts to establish a new rhythm for their day-to-day lives, cultivating the support and skills they need to address new challenges along the journey. The caregiver's journey does not end at stage 3. Adapting and adjusting to a new way of life is an ongoing process. Caregivers and their families may still experience new challenges that force them to adjust, but as the caregiver continues along their journey, they will build the tools they need to respond effectively. So understanding these missed opportunities emphasizes that the time for inclusive care is now. We know that based on the findings from the 2014 RAND study, that the best chance for a wounded warrior to recover and thrive is having a strong, well-supported caregiver. Additionally, via the Caregiver Journey Map, we know that a vulnerable point for the caregiver are those initial clinical visits. Then along the entire journey, there are opportunities for communication and collaboration amongst the care team. The caregiver is providing most of the care outside of hospital walls. Their input and understanding is critical for improved patient outcomes. So inclusive care is informed by patient and family-centered care. The Institute for Healthcare Improvement's triple aim and shared decision-making practices. In reviewing these practices, we took note that despite a great deal of evidence, that implementation of these practices increased healthcare team, patient and family trust decreased adverse medical events, and improved quality of work and life for the patient, the caregiver, and the healthcare team. And these practices are not the norm. So as we set out to design and implement this inclusive care, we were mindful of the disconnects between these research-based approaches and business as usual. So practicing inclusive care is amazing that my notes are so messed up. The Campaign for Inclusive Care strives for that quadruple aim that improves the quality of life for caregivers, improves veteran health outcomes, and improves the supports for providers and reduces care costs. So findings of this first stage of the quality improvement work was highlighted in a June 2019 issue of Health Affairs. In summary, inclusive care can help healthcare systems increase caregivers' inclusion in the care of people with serious illness by implementing 5 key components: system-level policies of inclusion, clear definitions of caregivers and their roles, assessment capacities of caregivers, explicit caregiver involvement, and sound caregiver professional communication. So for my family, my husband is, like I said, a veteran. He has chronic PTSD as well as borderline personality disorder, suicidality. In the last year, he's been in an acute care setting 5 different times. If I didn't know what the signs and symptoms were of what suicidality looks like, what I need to ask him, and then if I get, yes, I'm suicidal, yes, I feel like killing myself, what do I do then? If I don't know those things, then my husband doesn't get the care he needs. But I don't know what I don't know unless I'm being taught that from professional providers. So in the second phase, the Campaign for Inclusive Care brought in key stakeholders from VA and the Elizabeth Dole Foundation, including healthcare experts, clinicians, caregivers, to develop this mission, vision, and strategy of this initiative. The mission of the Campaign for Inclusive Care is to empower healthcare providers and professionals to engage veteran caregivers as part of the veteran care team through policy, practice, and cultural change. The vision of the campaign is not only for VA, but for our communities to make inclusive care the system-wide approach to veteran care that embraces, engages, and empowers these caregivers, the clinicians and veterans throughout the entire care journey from day one. Inclusive care increases the capacity and competency of the entire care team to deliver appropriate, efficient, effective, and high-value service. It improves health outcomes, relationships, the quality of life of not only the veteran, but the entire veteran family, and supports system-wide performance. It is truly team-based, with care being a partnership among the clinical veteran care team and family caregivers. It is centered around sound communication and secure feedback from all care partners. So as you know, a shift in cultural and the implementation of a new healthcare-wide initiative takes work, and it can even be challenging at times. Despite the challenge, we know that creating the Academy for Inclusive Care, building out the key principles as guidance, will allow us to implement a needed and consistent system-wide approach to care. So practicing this together through the adoption of inclusive care and incorporating caregivers into the teams is achievable and can be sustained when there is full alignment and participation toward a shared mission, vision, and goal. So clinicians from these visions, these are different VA systems, were the initial visions to participate in this inclusive care pilot program. A group of clinicians with diverse specialties helped to create the inclusive care training and the Academy for Inclusive Care. This Academy offers 4 online video modules moderated by Dr. John Torres. And with COVID happening in this last year, I'm sure all of us can we know probably more who Dr. John Torres was because he's the NBC News medical correspondent, to support these VA clinicians, social workers, and frontline staff in fostering this inclusive environment across the VA system. So that's where it started. These educational courses are designed to shift the culture of care, not only at the VA hospitals, but into our communities, to include caregivers on their Wounded Warriors medical team, reduce the challenges of being a caregiver, and ultimately improve health outcomes for both our veterans and their caregivers. So in a nutshell, this campaign is going to decrease veteran homelessness, decrease suicide in veterans, decrease the high rate of divorce. It is so much needed. In January of 2020, right before COVID hit, I am super excited to say that I was at this unveiling. It was my last trip before COVID last year. The Academy of Inclusive Care was launched. The Academy offers 4 online videos. They're resources that will support you as clinicians, social workers, as well as frontline staff in fostering an inclusive care environment across our systems of care. These first of its kind educational courses are designed to shift culture of care at, again, not only the VA hospitals, but into our communities to include caregivers on their Wounded Warriors medical team, reduce the challenges of being a caregiver, and ultimately, like I said, improve the health outcomes for our veterans and their caregivers. With the launch of the Academy, clinicians and staff can receive training and tools needed to better communicate with and work more collaboratively with our nation's hidden heroes. So the Academy for Inclusive Care topics include an introduction of inclusive care. Who are military and veteran caregivers? So in our Kansas City metro-wide area, when I first started Caregivers on the Home Front in 2017, most people thought that we were a professional caregiving agency and we provided care to in the home for veterans. And I quickly said that I have a veteran at home to care for, and I didn't need any more veterans to care for. We are specifically caring for these military and veteran caregivers who are family caregivers. Kansas City isn't a military town, so we have run up to a lot of walls, even though there are 425,000 veterans in Missouri. So we know there's family caregivers. We need to know how to communicate with a caregiver, and we need to understand their journey. So these themes were the key topics that VA clinicians from the pilot program foresaw to be the biggest learning curves that may be barriers to caregiver inclusion and interaction. So from there, practicing inclusive care. So now that we've discussed a brief overview of where we've been with the campaign for inclusive care and where it all started, let's take some time and review this actual practice of inclusive care. So recognizing that you may already practice inclusive care in one form or another, and furthermore, we know that practicing inclusive care can be very unique from one provider to another or one experience to the next. We also know that there are HIPAA rules and laws that we have to follow, but we want to remember this acronym of CARE. It's a great entry point to encouraging others around you to also prioritize the inclusion of caregivers and make inclusive care the standard of care across all of our health systems. So the first, consider who else needs to be present by asking the veteran. Is there someone you would like in the room during your visit? Is there someone who you rely on for support that you would like to have here as part of the conversation about planning your care? Or is there someone who helps you with your everyday medical or mental health needs? So don't assume the veteran can handle their medical care by themselves. You need to ask them directly to ensure clarity. If you all have ever met my husband or ever would meet my husband, he doesn't look like he needs 1 ounce of support or help from me at all. It's so important to ask. While it may seem like a simple question, by stopping to take the time to ask the veteran if there is anyone they would like in the room with them, or if there is anyone who is providing support at home that should be included in the care conversation, whether that be in person or virtually, we can begin to ensure that these caregivers are truly integrated into the team. We want to acknowledge and recognize that the veteran's caregiver has taken on extra work and that it will impact their physical and mental wellness. Empathetic remarks such as, "I imagine it's a big responsibility to care for your loved one, and I appreciate your dedication to their health," can go a long way to establish rapport between the clinician and caregiver. We call our caregivers hidden heroes. It's so important for them to be seen and have their expertise acknowledged. That simple acknowledgement and genuine appreciation will help build a connection that can be essential for the caregiver and for the veteran's care. It is also so important to educate caregivers about the impact caregiving has on health and well-being so they can be proactive in their own healthcare and engaging support. Just like professional caregivers, we know what burden is. We know what burnout is. We know what secondary stress is. These family caregivers may not know that. We want to review the roles and responsibilities that the caregiver is comfortable with by asking key questions for the caregiver, like, what tasks are easy for you to perform? And are there any duties that cause you to feel uneasy while you're performing them? If you've never asked someone if they're thinking about killing themselves or they want to die, that's a really hard conversation. So early identification of what the caregiver can and can't do will help ensure the veteran achieves their highest level of health and well-being possible. We often ask caregivers to do so much at home in the care of their loved one. So on an ongoing basis, it's important to be asked if they remain comfortable with the care we are asking them to provide, and if there are challenges that they're encountering. By continuing to ask this, we can ensure that the veteran is receiving the best support possible, and the caregiver then has the support they need at home. We want to encourage caregivers, find out if any barriers exist, and further how you can help overcome them to make the caregiver's responsibilities easier. Simple questions such as, how can I help you with your at-home responsibilities for the veteran? Or what would make taking care of your veteran simpler? Encouraging self-care of the veteran caregiver impacts the health of the veteran. Lots of caregivers are very reticent to ask for help. Some really might not even know how to ask for help. Asking direct questions like the ones above can open caregivers up and make them willing to accept some help. Encouraging and empowering caregivers to take assistance when necessary will make everyone's life easier and certainly positively impact the veteran's care. We're so lucky to work in the system that has so many incredible resources and services. And please consider referring proactively caregivers to your facilities. So VA, we have the Kansas City VA right here in our backyard. Let these veteran family members know that the VA has a caregiver support team. Many do not know that. We have so many supports to offer, and we truly need to make sure that we're engaging them in services that will help them take care of not only themselves, but when they're taking care of themselves, they're better than taking care of their veteran. So simple but direct actions around care, like inviting the caregiver into the room, learning about the caregiver by acknowledging their role and expressing gratitude to them as a co-member of the care team, greeting everyone in the room and not just the client or the patient during clinical settings, and asking key and meaningful questions to both the patient and the caregiver. Many of our veterans, if they have PTSD, their cognitive abilities decline. If they have traumatic brain injuries, that affects their cognitive ability. So even though they may look fine on the outside, right, we know there's these invisible wounds that we can't see, and we've got to be making sure that we're asking and engaging the caregiver. All can be transformative in establishing the collaboration and partnership needed amongst an inclusive care team. So here's some of the findings of the Academy for Inclusive Care. According to a 2020 review of a cross-sectional assessment of knowledge, beliefs, and perceptions about inclusive care before and after completing the Academy for Inclusive Care, 92% of the VA clinicians that initially went through this had an increased interest to practice inclusive care following completion of the Academy modules. 94% of clinicians had an increased need for self to practice inclusive care following the completion of the Academy modules. And then 8.9% increased self-efficacy of inclusive care, which was 7.92% prior to and 8.9% after having completed the modules, so which is a statistically significant change. So the practice of inclusive care, the VA leadership, where it was just a pilot, then decided to announce the immediate program expansion of the Campaign for Inclusive Care to VA system-wide. So it was a direct result of this, the quality improvement team's recommendations, and provided evidence of a successful pilot across the initial visits and showed the increase in enthusiasm to practice and knowledge of the inclusive care following the implementation of the Campaign for Inclusive Care. So given these milestones, here's what's next for the campaign. So they are implementing this VA-wide. I have had not only this opportunity to present to our community clinicians and providers, I've had a couple of other opportunities. So we want this to be in our communities as well. We want to recruit and train champions of inclusive care. And we want to achieve this quadruple aim: enhance patient and caregiver experience, improve the population health, it reduces costs, and it improves the work life of healthcare providers. We want to change this culture to make inclusive care not only the VA standard of care, but again, our communities. And really, we don't know what we don't know. So that's why I'm really excited that you all are here today. So how do you get involved? We want to encourage providers, staff, and your peers to complete they're only 15-minute education modules. We want to continue hosting these learning and training opportunities on inclusive care. We want to amplify the CARE principles with caregivers and veterans. And we want to sign on in support of a system-wide approach to this inclusive care. And you can find and share resources at the campaignforinclusivecare.org. So here are several examples of resources that you can actually access to amplify your efforts or educate the education around inclusive care. This includes, there's care cards, journey maps, tip sheets, flyers, and training kits. And if you're interested in these resources, you can also go to the campaignforinclusivecare.org. You can reach out to me and I can get them for you as well. So here's a little bit about the VA Caregiver Support program that I was talking about earlier, that again, many of our family members don't even have any idea that there's a VA Caregiver Support for them. So it's a primary location where people can access the information of caregiver support, not only the family caregivers, but our providers in the community. So that is a very quick overview of the Campaign for Inclusive Care. And again, military and veteran caregivers don't often ask for help, but they deserve our support and collaboration as they answer the call for service each and every day in this country. So the expansion of the program of comprehensive assistance for family caregivers, that is under the Mission Act of 2018, which establishes this enhancement of robust supports under the program of general caregiver support services through the VA and initiatives like the Campaign for Inclusive Care. And they're so vital to the health and well-being of our nation's caregivers, these hidden heroes. So I really encourage you, as a caregiver myself, as a social worker, as a family member of a veteran, to act as a champion, advocate and accountability partner in the Systemwide Change initiative to incorporate caregivers into the care team. And it is all for the better health outcomes for our nation's veterans and their families. We know, I'm going to stop sharing here. We know that we have a high suicidality rate of veterans. We also know that veterans who have family members spend more of their time at home. So how can we educate and best support those family members? Because those are oftentimes the first people who are seeing the signs that their loved one coming home after getting out of the military just isn't the same. But we've got to give them the tools to be able to reach out. And this is one of the ways. And with that, I'll open it up for questions, comments. I know that was quick.
So Shawn, we have a couple of questions. So Kimberly said, first thing I want to say is thank you for this. My brother is an Army vet, and I hope that if he ever needs caregiver services, either I or someone with a lot of patience can be there for him. So the two questions are, I'll ask you one and then you can answer and I'll ask you the second one. What was the statistic for caregiver vets that have suicidal ideation?
So out of 458 caregivers that were surveyed, it was 23.6% of those that reported suicidal ideation. And that was since becoming a caregiver. So it wasn't before, it was the effects of caregiving that bumped suicidal ideation up. If you all want to look that up, so the report or that research article is done by Dr. Roxana Delgado. She is out of University of Texas at San Antonio. She does a lot of work on the veteran space, and the small amount of research that is out there, she has championed it.
Thank you. Okay, so number two, what are things you would tell your younger self before you became your husband's caregiver?
Okay, so I'm not unique, although I am a little bit different in that I met my husband after or as he was being medically retired from the Army. So I didn't know my husband prior to his invisible wounds of war. He did 7 combat tours to Afghanistan. But I will tell you that on our first date, when he said, I've got PTSD, I'm a recovering alcoholic, when I thought, oh boy, it's okay, I can fix all that. As women often think that we can fix everything, right? Knowing that there's only so much that I can control, it took me several years to understand that as much as I can look for the signs and symptoms of suicide, I can manage triggers, I can't control all of them. And I took a huge, heavy burden that started affecting my own mental health and wellness in 2017, where I was isolating myself, taking on these really the symptoms and behaviors of my veteran, I was taking them on. So to really, if I could tell myself what I know now today, is really understand you can't control it all, and you've got to reach out and get help yourself. It cannot only be about the veteran getting help.
Thank you. Okay, so the other question is, how would we request you or someone from the Academy to come speak at a company?
If you will email me, it is Shawn, SHAWN.more@caregivers-homefront.org. That is how you can reach me. That is how you can get more me to come and present at your organization, your practice. You can get resources. If you've got family caregivers, please have them reach out. One of the big things, like I said, that we do at Caregivers on the Home Front, it's all mental health based programs. They're evidence based. We use best practices. It's all free to our family caregivers and their kids. If they need resources, if you need resources that you're not sure of where to look, please reach out. We do what we call a mental health and wellness restorative weekend, where we have 12 to 14 caregivers come in to either here in Kansas City, but we also travel out of state to do these weekends. It's a full entire weekend of us making sure the caregiver, the family member, is taking care of themselves. We don't talk about their veteran, but we make sure that they have safety plans in place. They know the difference between symptoms and behaviors, huge differences between symptoms of PTSD and behaviors. And some of those behaviors put our caregivers and those children in non-safe environments, but they don't know how to set those boundaries because they don't want to be looked at like I'm supposed to be taking care of my loved one who came back from war, and he or she has these the symptoms of war that we come home with. They're afraid that if they set these boundaries, that they're going to be looked at like they're not taking care of their veteran. So we talk about identity. A lot of these caregivers step into this role of caregiving unconsciously, and then it becomes their entire role. Their entire identity is focused on caregiving. And we always tell them caregiving is going to end. No matter what, caregiving is going to end. We don't know when or how, but how in the world do we set ourselves up for success when that does end? And we've got to give them the tools to be able to do that.
Thank you. Okay, we have another question from Emily. Okay, so could you recommend kind of like sort of a one-stop shop for an online list of resources for caregivers of veterans?
Sure.
I'm no longer located in the KC metro area, but in more of a rural area of Kansas, and trying to rebuild that huge binder of resources I've saved from all the different needs I encountered in my work as an LMSW.
Absolutely. So one of the best resources for caregivers as well as veterans is at elizabethdolefoundation.org. They have a vetted list of resources all over the United States. So you can type in your location, you can type in, there's different eras, right, of veterans, and not all the services out there, resources out there are available for every era, where our Vietnam era veterans may not get the support of our post 9/11. And then we've got Desert Storm era veterans. So you can type that all in and really hone down on to what you're looking for. Is it financial support they're looking for? Is it housing? What is it that you're looking for? The elizabethdolefoundation.org. They do a really great job of vetting those resources and keeping them up to date. And please reach out if you can't find something.
Okay, any more questions? Still have a little bit of time. I'll give it like one more minute.
I just want to say to all of you, this is a huge, it's a huge deal for me personally that you took the time to come on and learn more about veterans, how we support them as well as their family, because we don't often see it in our area because we're not a quote military town, but the need is out there. We see it every day. We've got caregivers in crisis that call us quite frequently, and they want to make sure that when they call a clinician for support, that clinician understands this military and veteran culture. And if we don't understand that, we're missing out. And it's a whole entire different culture. where I may come in and go, my veteran he punched some holes in the wall and called me some names. You may immediately go, oh no, you shouldn't be in that situation. Well, dig deeper and find out what's going on and how you can best support them. We just don't know what we don't know. And you all can take this information, spread it to just one person, find one person that needs this resource, and we can continue it growing to Missouri's one of, it's the 5th largest state for veterans. So we do have a lot of veterans in our area. You mentioned that you were on the Kansas side. Kansas is huge, and we are very rural. We oftentimes don't think about it here in Kansas City, but there are many caregivers and veterans that are very rural. Veterans tend to like to isolate, but that also means they're isolating their family members. And that's where it's really hard to find these resources and find the caregivers and the family members that need our resources. So just taking it and putting it in your back pocket for a rainy day when you need it.
So we just had a couple of thank yous. So Coco said, thank you so much for so much, especially about caregivers' needs. Everyone is affected. So thank you. And then we had a couple more thank yous. Emily, well, let's see. Marty said, excellent presentation. And then Joanne said, thank you very much. And Emily said, thank you so much. This is invaluable. Thank you for taking your time and the work you're doing with veterans. Any more resources you can think of at all, a follow-up email would be very much appreciated by everybody.
I will send you. Absolutely. I have got a wealth of resources. One that I can think of offhand is Psycarmerorg. Psycarmerorg. It is for veterans, caregivers, education, like teachers. It's for clinicians. It is a wide range of resources. Suicide prevention. How do you coach a veteran into care? What is PTSD? What is depression? And how do you care for yourself? There's snippet 10, 15-minute videos. Awesome resource, psycarmerorg. And I have a ton more. I'm going to put together a list. I'll send you some of them and then you can send it out. And please feel free to email me. If you're looking for a resource, or I can just type some out and send it to you personally, don't hesitate to reach out. Caregivers -homefront.org is our website. You can reach out, check that out, check out some of the caregivers and our mental health and wellness restorative weekend that we do. You can see some of the caregivers and exactly what we do on those weekends.
I'm putting your email right now into the chat so that everyone can see. There we go. So everybody now should have access to Shawn's email. Hope that was okay, but you had said it was
Absolutely.
Okay. So,
yes, please.
I figured, yes, it was fine.
Yes.
But I want to thank everybody so much for attending today. Shawn, thank you so much. I think this was very informative, and I think something that a lot of us forget about. A lot of it, we might focus on the veteran, especially when you're thinking about mental health and potential PTSD or diagnosed PTSD and or any other mental health condition that might come to light. But a lot of times I think we forget about just the crucial role caregivers play for veterans, or really even anyone with PTSD.
Absolutely.
Honestly. And we know that PTSD is quite prevalent and probably not diagnosed nearly enough. So thank you everybody for taking the time, and Shawn, thank you so much for bringing this to light and taking it out and talking about it. So we thank you so much.
And thank you for having me. It truly, Y'all, when I say it's a personal mission, because I live it every day. So I want you to know how important it is for our community to really look past the veteran and see how we can support our family members. I mean, just think about this. My husband's been in a suicidal crisis 5 times over the last year. Okay, if I didn't have the support and resources, what do you think that's doing to our families' mental health and wellness? We have kids. What is that doing to our kids' mental health and wellness? So it's a huge thing that we've got to look past that veteran. Make sure, if you don't have the time, have a list of resources. Hey, if the family member doesn't come in with the veteran, here's a list of resources that you can give your family as well. Huge for families, because a lot of them don't have the resources.
Yeah, so thank you. I did want to invite everyone to our next webinar. We have a webinar on the 2nd and 4th Thursday of every month from 3:30 to 4:30. We also, one other thing that you all might not know about is that we are on Fox 4 on the 3rd Thursday of the month at around 9 to 9:15 in the morning, just for a couple minutes talking about a different topic every month. So join in, come look. I think our next topic is actually, we're hoping that Shawn is going to talk, talking about kind of gearing up for Veterans Day, and focusing on the needs of all. But the next one is October 25th, or not October 25th, October 21st. So sorry. So we hope that you can tune in for those couple minutes on Fox 4. But our next webinar is going to be the 2nd Tuesday in October, so October 14th. And we have Quinn Irby with the Kansas City Anti-Violence Project talking about the Kansas City Anti-Violence Project and about LGBTQ plus issues and considerations, especially thinking about mental health and mental health needs, and how to be like inclusive when caring for individuals. So we hope that you are able to join again October 14th, 3:30 to 4:30. Registration is already on our website, so mentalhealthkc.org. Emily, that's a really good question. We've kind of been trying to like grab them as we can, but we're gonna try to be more intentional about that. It just started like a couple of months ago, and the first time we were able, like, just old school like recording on here, but we're trying to figure out a better way to be able to record that. So really good question, Emily. We're trying to figure that out. So so hopefully we'll be able to do it. But yes, Kimberly. I think Kimberly had a question. Do you want to put it in the Q&A, Kimberly? Or I'm going to allow you to talk if you'd like.
I'm so sorry. That was an accidental push.
That is okay. That is okay. So, okay. Yeah, so Emily, there is a distribution, like a news, like a listserv, but right now we just more or less have our webinars on there. Definitely, if that is something that people are interested in and having more of like a newsletter, let us know, and we'd be happy to see if there might be somebody that could create that for us. So right now we're really just a group of volunteers, like through our community mental health centers, that are just doing this because we know that it's the right thing to do for the Kansas City Metro. But I love that idea. So Emily, if you go to our website, mentalhealthkc.org, you can sign up there just to even just be on our distribution list. But by coming today, I believe you have the opportunity to be added. So thank you all so much. So again, our next one, October 14th, 3:30 to 4:30 with Quinn Irby, talking about Kansas City Anti-Violence Project and LGBTQ+ inclusion into the mental health sphere. So thank you all so much for joining. I hope everybody has a great rest of your day. Thank you. And Shawn, thank you so much. We really appreciate it. I think we only have a few people
Thank
left.
you.
Dan, Marty, Monique, do you have any questions?
Thank you, Dan.
Oh, thanks. Okay. Well, thank you so much. We really appreciate it. And I hope you have a wonderful rest of your day.
Thanks for having me.
Thank you, Shawn.
Bye.
Thanks. Bye.